Okay. Right. Hello, everybody. Welcome to this public accountability meeting. We've got a slightly different agenda today than we normally do because of the COVID-19 situation. So we're going to use this opportunity to provide an update to people and to the public on the readiness of the policing and fire and rescue services here in North Yorkshire. People can ask some, we'll ask some questions. Of course, there's always an opportunity to send questions afterwards as well via the info@northyorkshire-pfcc.gov.uk email address. So I think we'll get straight on to business. Everybody's very busy at the moment, so we're going to try and keep this quite tight as well. So Lisa, do you want to, Lisa Winward, Chief Constable of North Yorkshire Police, would you like to start off?
Thank you, Julia. Yes, and as some people may have helpfully seen earlier today, a joint message from the Police, Fire and Crime Commissioner and my colleague Andrew Brodie as Chief Fire Officer and myself, the core focus of North Yorkshire Police at this time is on keeping our communities safe. We absolutely want to support our health colleagues and the NHS to be able to treat those people who are ill. And therefore, the advice that has been issued by the government in terms of isolation and the limited reasons why people might have to venture out away from their homes, North Yorkshire Police will do all that we can to support our health partners to keep our communities safe. So there is a full command structure in place nationally, with the NPCC Chair, Martin Hewitt, and a silver function. And we as North Yorkshire Police are playing our full part in that national structure by having our own arrangements set up here in the county to support partnership working with our local resilience forum, with local authority and health partners, very closely working together to ensure that we can be out there delivering a service to you as North Yorkshire Police. Our current service is exactly as it was before. We are delivering a service to the community and keeping you safe and answering your calls in the control room and have the capacity to do so. But we need to make sure that you follow the government advice, and North Yorkshire Police's job will be to be out there in the community speaking to you from a safe distance, still using the isolation advice, but please assist us to work in partnership and keep our NHS running and keep our people safe. I know that Mike Walker is also on the line, so it may be an opportunity. Mike Walker is our Assistant Chief Constable, who is our Gold Commander, specifically for North Yorkshire, and has been working on the operation now for a couple of weeks, and therefore I would invite him maybe to give just a further bit of detail about specifically those actions that are taking place in North Yorkshire.
Thanks, Lisa. Mike, if you'd like to just provide a bit of an insight into the way perhaps the agencies are working together with the police as well as what you're doing as well.
Yes, can you just check in? Can you hear me okay?
Yes, everything's fine.
Yeah, excellent. Yeah, so as the Chief Constable's mentioned, we have been running a full command structure within North Yorkshire Police for over 2 weeks now. What that in essence means practically is that we're holding daily meetings to discuss the impact currently within North Yorkshire Police itself and on our policing services, but also on a daily basis, as everyone is nationally at home anyways, monitoring the national government advice, which has been coming in at 5 o'clock on an evening, and responding to that accordingly. Those meetings, so that's at gold, silver and bronze level, have what I would describe as ramped up over the last couple of days based on the new restrictions that have been put out by central government, and we are having several meetings every day to look at the impact that those restrictions are having within communities in North Yorkshire. I'm also the chair of the Strategic Coordination Group, which is essentially all of our partners, local authority partners and other blue light services. And that group sits now several times a week, again, to assess the impact on communities and look at areas such as those who part of the 1.5 million that have been written to across the country now, to look at how we as partners look after the most vulnerable. So that's getting care packages out to them, such as food and medicine. So I chair that group also, and the police are heavily involved in working in partnership with that. We're currently, from a policing point of view, as the chief has mentioned, in a business as usual, in what we would call a blue status. We have a graduated response from a policing point of view in terms of the ability to manage demand, so that when and if demand outweighs our capacity to police, we take that to a next level and bring in our contingency plans in terms of bolstering frontline critical policing services. But at this point in North Yorkshire, we are managing really well. Our absence rates as a police force are lower than some other areas across the force, but that's been monitored several times throughout the day to make sure that we're able to move resources around to match the demand. But what we have done over the last couple of weeks, because we have been running regular meetings, is to make sure that we actually reduce the demand in terms of the incidents on the force control room, which then allows us to free up officers to do quite a lot of reassurance, but also specifically now today, quite a lot of engagement with the people that are currently out in the public and asking them questions in terms of, are you out there? Essentially, are you travelling to and from work? Are you doing essential shopping? And making sure that people are sticking to those national guidelines. And that's our real focus now over the next 24, 48 hours, is to build the intelligence picture across North Yorkshire to assess, are people staying at home when they should be? The plan later today is to assess whether or not we think that's working in North Yorkshire, because certainly over the weekend, in some of our tourist areas and at the coast, we saw some really inappropriate behaviour by people and really reckless behaviour by going places and mixing with each other when that they should not have been doing that. So today is a real litmus test as to whether or not people are actually listening in North Yorkshire. And we will, once we get the power to enforce the new regulations and the new powers and legislation that's coming in, we will start to enforce that. We hope we don't have to, but we'll have to see. But we'll base that on some of the assessments that we make throughout the day when we're getting around the force and we're engaging with the public. The public will see a greater police presence. We have cancelled various different non-essential training events. We have more officers and staff able to react accordingly because we have those business continuity plans. But our job now is to ensure that people are sticking to the national government guidelines.
Okay, Mike, so that is really helpful. Does anybody on the line have any questions for Mike and Lisa? Well, I've got a few. So there's been a lot of stuff in the national media around public protection equipment. Obviously, people are concerned about the welfare of police officers and police staff. Do you feel you are sufficiently well equipped in respect of that?
Yes, we are. We have, through our meeting structure, logistics is one of the key areas, and logistics in terms of personal protective equipment for those frontline staff has been one of the key priorities throughout the work that we've been doing over the last 2.5 weeks. We have put various measures in place in terms of ensuring that we order the right amount of equipment and it's delivered to the various different stations and offices that we have across the county. And we also have different layers underneath that to ensure that when equipment arrives, it's properly managed, it's signed in and out, it's given to the right people, so that if and when we send them to incidents or scenarios where there's a potential risk of COVID-19 transfer, then they've got the right equipment to be able to do that. It has been challenging. I won't deny it has been challenging to get that kit out there and maintain it. but it's a key priority that's looked at several times a day. But I'm satisfied at the moment that we've protected our staff sufficiently and will continue to do so.
That's really helpful, Mike. So you mentioned that there's legislation going through Parliament at the moment that will give the police additional powers. Can you just explain a little bit what those are and when you expect to be able to use them?
I keep asking the question in terms of when we're going to be able to use them, because I am impatiently wanting to get those powers given to the police officers and staff as quickly as possible. It's expected it's going to be Thursday. Hopefully it will be before then. But the powers in general will allow us to be able to fine individuals if they are not adhering to various different restrictions that are placed upon them. But also, just from the police's point of view, there are other powers that the Local Resilience Forum will get in terms of working in joint partnership to ensure that we have our contingency plans in place around dealing with, unfortunately, some of the issues that will fall out of the pandemic across North Yorkshire. But certainly, from a policing point of view, it will give us those tools to enable us to reprimand those individuals who are not doing as they're told and not staying at home.
Chief Constable, did you want to just add to that?
Yes, please, Julia. Just from a national perspective, of course, the stance is very much that in this country we police by consent, and we absolutely can only deliver our job through support of the public. And the policing style, and I think some people may have heard our National Police Chiefs Council lead, Martin Hewitt, speaking in the media only this morning, is overwhelmingly we want to continue to adopt that community style. And therefore, the start of this process that quite rightly Mike describes is engagement with the public and encouraging people and speaking to people and delivering information so that they can make an informed choice about supporting the health service, so that we don't have to enforce any legislation. But of course, there will always be those cases where individuals won't listen to that reason, and therefore we absolutely need to have those powers to support us to ensure that we can do our best to support our health service. So in the first instance, I suppose the reassurance is our policing style will be just as it is now, engaging and talking to members of the public and encouraging them to do the right thing for our health service. But we absolutely need the backup of those policies and legislation so that those people who won't comply don't put the rest of the community at risk.
Okay, that's really helpful, Lisa. Tom, did you have something you wanted to ask?
Yes, I think it's probably largely been covered there. I was just going to ask around the fact that there's been a lot on social media about messages from what are taken to be police officers and how you will be engaging with people to try and understand whether they are actually taking these things seriously, and I guess quite a bit of it might be up to local knowledge as well.
Absolutely, yes, and this is where community policing is at its best, really, in terms of those officers and staff and volunteers who are already working in those communities and know who their vulnerable members of their communities are and regularly engage with some of the people on a day-to-day basis. There are conversations going on nationally, and as Mike has said, there are national phone calls on a daily basis and then shared out to ourselves locally of the style of policing, as I've already said, of having those sensible conversations with people, engaging with them and finding out what their plans are, advising them, reminding them of the advice. And it really is a stance of last resort for us to go down a route of enforcement. And as Mike has said, it's looking like that enforcement will be in respect of fines. Because, of course, we don't want to also overload the criminal justice system in terms of taking more decisive action in terms of arrests unless it really is putting public safety at risk. So therefore, the legislation is more there as a contingency plan where we can't encourage people or engage with people to do the right thing to keep our communities safe. Practically,
if I just come in practically, Tom, and for everybody online. What I've instructed and asked for this morning is that officers are out of the cars, they're on the high streets, they're around the supermarkets, they're in residential areas, they're in those areas, coastal areas, the likes of Hawes and other tourist areas, asking people questions, because if there are groups wandering around or individuals wandering around, there's nothing wrong with those local officers asking them a question. Are they picking up essential shopping? Are they picking up essential medicine? Are they doing a chore on behalf of somebody? Because that advice needs to be given at this point in a neighbourhood policing style. However, that's what I've instructed this morning. So the public will see people getting pulled over. If we're seeing motorbikes going around the county, they will be pulled over and asked, are they going to work? Are they coming home from work? Are they going to get essential shopping? These are the questions that I've instructed today are asked of the public out in North Yorkshire. And this is, at the end of the day, I'll be getting an assessment as the goal commander of, are the public of North Yorkshire listening to what the government advice is? And if they aren't listening, then obviously we will be more robust in how we then police and in terms of how we communicate with the public, because it's really, really important to listen to what was said to them last night. But yeah, we are doing quite a lot of engagement, so people will be spoken to and they will be asked questions that wouldn't normally be asked, but we're not in that normal state of policing, unfortunately, now.
Thanks, Mike. I'm just going to, Tom, I'll bring you in a moment, but just in relation to the force control room. So I've had some questions asked about, if people see, so obviously we're not supposed to be out and about in groups of more than two out beyond our immediate households. If people see groups of people congregating, should they be calling the force control room and letting the police know?
We are already having calls like that, Commissioner, where people believe they may be breaching the national guidance that's gone out. We had some calls last night out in rural areas of groups of youth congregating. Bearing in mind that was before the increased restrictions. But yes, we do expect the public, if they do truly believe that there is a risk in terms of what people are doing, to make contact with us. We had it over the weekend in relation to licensed premises and restaurants, and the public were contacting us. What the public need to understand is that we are policing in a state of normality, but if we do get inundated with calls, obviously we'll struggle to deal with all of those calls. So just be sensible, use the 101 number should you wish to report anything around that. But we'll continue to give advice around that as the days move on, because we've really got to manage the demand that's coming in. We need to try and stem that demand as well that's coming in from the public by, again, going out and engaging and making sure that we enforce the measures that have been put in place. So all being well, in the next few days, we will have, and the aim is we will have limited reports coming in, because people will listen to that advice.
Okay, that's helpful. Tom, did you want to talk about ask about holiday parks?
Yeah, multi-part question on that front. A bit first of all about roads policing and obviously people moving around on our roads and travelling some distance, and that leads into holiday parks and sites. There's been a little bit of traffic on social media again around people who are currently on holiday in caravan parks or holiday sites or holiday cottages, and some nervousness about actually, even though those sites are meant to be closing down, nervous about leaving those with the risk of potentially being fined as they travel back home across the country on the roads network, and some concern about being stopped by the police in the process of doing that. Can you clarify, just for those people as well, what action we're taking around roads policing at the moment? B, what monitoring you'll be doing of holiday parks, caravan sites, and the like, and C, any advice on to those people who might be in that situation where they need to travel back home around how they should do that and how they should convey that message to the police if they do get stopped, please.
Okay, so Lisa, just 1 second now. Just can you just also just mention speed camera vans in your answer as well? Thank you.
Yeah, yes, will do, Julia. So yes, it's a really good question, Tom, and we would expect our holiday parks and campsites to be taking exactly the same advice as everybody else from the government and acting responsibly, and supporting their local communities and their local NHS to cope with the people who live and work in that area, and therefore do the right thing by the government advice in terms of people not using those holiday homes and causing a situation in those local areas where there isn't the capacity to support people who are ill. I would like to reassure the public that if members of the public are going about their business in line with the government advice, if they are pulled over by an officer and asked, where are you going? And they explain that they're following the government advice of leaving a holiday home to go back to their home address to isolate, which is what the government have asked them to do and what we would ask them to do, they are in no risk whatsoever of being prosecuted for doing so. They're doing exactly as we would ask them to do, is take themselves back to their home addresses and isolate at their home location. So I'd like to reassure the public that that's exactly what we would expect them to do, and I would appeal to the holiday parks and camps to encourage people who may be using holiday homes on those sites to do just that, to get themselves back to their home addresses, and we'll support them in their actions to do that by, like I've said, stopping and speaking to people, taking a sensible approach and engaging with people in a way that British policing does best. But in respect of that, we are really mindful, as Mike has already said, that people might take the advantage to go out on their motorbikes because the spring weather is coming, to go out for a run around in the car because people feel cooped up in their home addresses. I would urge people to take the government advice of stay at home and be isolated and only go out for those reasons that the government have stipulated. We have very, very tragically and sadly seen somebody killed on our roads in a motorcycle collision only 2 days ago, and I would urge people to not go out and use the roads in an irresponsible way because they're quieter than usual. For exactly that reason, we want to keep people safe and make them feel safe, as you all know from our police and crime plan, but that includes keeping people safe on our roads. And despite some of the challenges of coronavirus and some of the other challenges we've had just recently with flooding and other community issues, there are still people who are being killed and seriously injured on our roads. And therefore, we still want to keep those people safe. And one of our key opportunities to do so is working in partnership with 95 Alive and our safety camera teams is to keep you safe on our roads. So you will still see activity on our roads because it's still our responsibility to keep you all safe on our roads whilst these other challenges are taking place in our communities.
Thanks, Lisa. I mean, I think we certainly had quite a lot of complaints into the office over the weekend about the camera safety vans and people asking why they should be deployed at this moment in time. And I think you've answered that question. I think what we'll do is put some further clarification out about that and perhaps provide a list of frequently asked questions so that people can sort of understand this, because I think, you know, we have country roads which are far more dangerous than the motorways in terms of killed and serious injuries, and you know, we don't want empty roads to be used as a racetrack in North Yorkshire because it's difficult for the individuals should they have an accident, but also, you know, there's the pressures on the NHS at the moment are incredible, and we wouldn't want to add to them. So I think that's a really important message. Do you, Lisa, do you feel more broadly in the round confident that we have the resources we need to keep people safe at the moment, that people are, you know, they obviously post austerity and all of that, people are concerned about that? What's your view on that at the moment?
Well, quite rightly, the College of Policing and our National Police Chiefs Council have had some very detailed conversations around protecting the public, keeping them safe, about keeping our own staff safe, but also about the uplifting officers and staff that we want to see coming into policing. And for that reason, recruitment will continue in a safe way. So I feel confident that as a police service, we are now starting to see some of the impacts of the 20,000 uplift coming and joining us on our teams, landing on our areas, being tutored by tutor constables. And as Mike has already pointed out, some of that non-essential activity that sometimes goes on behind closed doors in policing from a training perspective, we're taking a sensible approach to people's accreditations, and therefore you will see more people released out onto frontline duties that would otherwise be training or otherwise in some jobs. So I feel comfortable and confident at the moment that we are delivering a service well within our capacity at the moment, but of course that is being monitored very closely on a day-to-day basis.
Okay, Lisa, that's super. I'm just conscious of time and the fact that people have got other meetings to go to. So Lisa, I think we've had one question for the police that's come in on social media, which is, are you enforcing Section 21s?
I may have to defer to Mike on this in terms of somebody elaborating on Section 21 of which particular act and section of the law.
I was hoping that you might know that.
Okay, so I don't know whether we can seek clarification from the question about, because obviously every set of law and legislation have acts and sections in them. So lots of laws will have Section 21. So I'm just trying to establish here from, and I think somebody's just putting some further update on here, specifically what they mean by Section 21 of which legislation. So just bear with me. So Section 21, how will the police, the amount of time people are spending outside and reasons for doing so, and prove why they are there?
Lisa,
so I think,
Lisa, can I just say this question? I'm not sure whether this person's come in a little bit later on, but I think we've actually answered quite a lot of these questions in our earlier discussion. So certainly, I would refer people to look earlier in the recording. I don't think there's anything there that we haven't actually answered.
Yes, just having a look through at the question that appears to have been posted, that's been sent through to us. It's basically reflecting how are the police going to go out and know why people are out and what they're doing, what PPE do we have, etc., etc. And as you've said earlier on, I think we've talked about, we're going to go and engage with people and ask them where they're going and what they're doing, and our community policing environment knows some of these people and engages with them on a regular basis. So yes, I think looking at that, we've covered a lot of it in the previous part of the meeting, and PPE, etc. There's an element there also asking about who's defining the word essential in terms of people going to work. I would say that's not a matter for the police. If further clarification is required on the subjectivity of essential people going to work, that will have to come from the government.
So that's really clear, I think. So what is defined as essential is defined by the government, and we've sort of you've answered the questions around people who are not doing what they should be doing and how you will handle that, and we've also answered the questions around PPE as well, I think, which at this moment in time seems to be reasonably satisfactory. So unless there are any more questions, I think if there are any more, we can answer them after this. But as I said, people have got work that they need to do. So Andrew, could I bring you in now, if that's all right, please?
Yes, good afternoon, Julia. Good afternoon, everybody else watching and listening. So Fire and Rescue Service update, Julia, yes?
Yes, please. So how you're handling this.
Everything's gone rather frozen
what
at
the
the moment.
public should expect to see, and how you're helping with the this national emergency.
Okay, thank you, Julia. The feed was rather breaking up then, but I think I got the gist of what you were asking. These aren't normal times, so we're not operating always in the normal manner. However, I can provide absolute assurance that we continue to receive every 999 call and respond to all of those in the normal way. So our operational response hasn't changed to any great extent at the moment. When we do attend an incident, of course, we minimise our contact with members of the public to prevent us spreading COVID-19 and also to prevent us contracting COVID-19 from those that we deal with. But we do respond and continue to respond to every operational incident that we are called to. I've got a short presentation that I'm going to bring up on the screen now. I think everybody will be able to see it. And it
Andrew,
just sets out.
Sorry, Andrew, can I just very quickly? I was trying to rush through there a little bit because we need to finish by about 2:15. If that's all right.
I'm going to be very quick.
Super. Thank you very much.
Quick indeed. So our strategic priorities, our strategy statement is that we will normalise service delivery and enabling services as far as we sensibly and possibly can. We are not ignoring this in any shape, way or form. We're taking it extremely seriously, and we would ask the public to also take it extremely seriously and follow the rules to protect themselves and protect others. Our strategic priorities, you can see there, are to minimise exposure and risk of spread to the wider organisation. This is to maximise the level of staffing that we've got so we can maintain our service delivery, particularly response. To minimise the spread, our spread to other people and receiving it. To maximise our ability to maintain critical service delivery. And by that, I don't only mean response, I also mean the prevention, protection and resilience tools that we use to keep communities safe as well. And to provide assurance and manage the expectations. The public, quite rightly, expect us to maintain services to keep them safe during any crisis. The COVID-19 crisis is no different to those, and we will continue to do so. The approach that we're taking to each of the activities that we would normally undertake is threefold, and we try to stay as far to the top of this model as we can. So we assess each activity and we continue if it's safe to do so. If it's not safe to do so in the normal manner, then we will look to adapt it and continue it. So, for example, our prevention and protection activities, it would not be sensible for us to be in the houses and the businesses of people across York or North Yorkshire because of that danger of contracting or spreading the virus. But we don't stop those activities. We adapt the way that we deliver them, and we do it by telephone or by video conference or indeed by sending advice to people. And there's also advice on our website. If we assess something and we can't put in reasonable adaptations, so we can't change the way that we deliver it or provide personal protective equipment, then we would cease that activity, but regularly reevaluate it. But at the moment, we haven't ceased activities. We have adapted many of our activities and we continue as normal in terms of our operational response, albeit, as I said earlier, minimising contact with members of the public as far as reasonably possible. We've put in, and this is an untidy slide, I apologise, it's just been done this morning. We've put in place structures to make sure that we are able to receive advice and guidance from the 4 areas at the top of this model. We meet as a senior team, as the gold team within fire, 8 o'clock every morning, 5 o'clock every night by video conference. We are all now working from home. The headquarters building from a fire perspective is pretty much empty, and everybody who can work from home is encouraged to do so and enabled to do so and required to do so, I suppose. It's only our station-based staff who are continuing to go into the workplace as normal. We have a number of North Yorkshire meetings which we and other partners are part of. The Strategic Coordination Group, which is chaired by Mike Walker, who spoke earlier, the business continuity meetings internally, and then we have a gold meeting every Friday, but also the less formal ones twice a day by video conference. And that all feeds down into a silver or tactical group. So they take the strategy that we set, they turn it into tactics, and then through the daily meeting with all of our station managers and the daily internal communication that we send to all staff, those are turned into tasks for delivery by our frontline and enabling services teams. So What the public can be assured of is that we are very much operating as normal in terms of operational response. If they dial 999, the call will be answered. A fire appliance will be mobilised as normal. We are adapting the way that we approach other parts of what we do to make sure that we continue it as normally as possible. And we're making sure that we are receiving all of the information that we need to make sensible decisions. We're strategizing them, we're turning them into tactics, and our staff on the front line do know how they then deliver their tasks on a day-to-day basis. So hopefully that provides you with some assurance that we are operating as best we can.
Okay, that's really helpful, Andrew. And does anybody else have any questions? Thank you for that. No. So I've got a question, Andrew. So what are you doing to support our partners in the local area?
So we are working with the North Yorkshire Local Resilience Forum to coordinate centrally the way that we are able to contribute any capacity within the Fire and Rescue Service to support other organisations. The Yorkshire Ambulance Service may make a request that we could support them, and we're identifying which staff we can free up whilst maintaining our ability to deliver our services, particularly response, so that we can share some staff, share some resources where we're able to do so, where it's sensible to do so, to help the wider voluntary and sector provision and to support our public sector partners.
Okay, so that is really helpful. Have you, is there anything that you're sort of concerned about that you feel you need more support on?
Not at the moment. So we are getting lots of advice and guidance nationally through the National Fire Chiefs Council, through the Home Office and other departments, through your own office as to the prioritisation. We are struggling, as every fire and rescue service is, with the supply and demand of personal protective equipment and hygiene facilities. However, that is being addressed nationally through the National Fire Chiefs Council, and hygiene packs are now, as we speak, being sent to every officer and every fire station to support us in being able to continue our work. Okay,
that is fantastic. Okay, so we've got another question that's come in about the laws that are going through Parliament at the moment around enforcement and telling people to go home. I think what we probably need to do as a consequence of this, because people naturally have got an awful lot of questions around how this is all going to work, is that once those laws are passed through Parliament on Thursday, that we just put some frequently asked questions up on North Yorkshire Police's and our own website, so that we can, so that people have a sort of ready reference to those. Would that be okay? I'm sure there'll be guidance nationally as well, but I think people want to understand locally how we're going to address this.
Yes, absolutely, Julia. I think there will be a national guidance document to the public about the laws aren't passed yet, and I think they also need that guidance around them, because the legislation itself is a very complicated piece or very complicated document. It will come with some layperson's advice to the public, I would imagine anyway, nationally, that we can then share more locally.
I think that'd be really helpful. So, Mike, I mean, what you said earlier on about the way you're going to go about things was really helpful, and so I think it's those sorts of things that people need to understand, because obviously the law is complex and how you interpret that can be complex as well. So it's, you know, just you know, as we don't go about our daily lives anymore, what are we to expect on a practical level? And I think those types of questions will be really helpful for people. So I think perhaps towards the end of the week we can probably just try and draw that up based on what comes out nationally.
Yes.
Yeah.
And what I'm telling the officers is and when we get the powers, is not a case of I don't necessarily want to be handing out tickets and fining people. We want people to stick to the advice. We want people to stay at home, but we will be engaging with people. People need to expect us, if they are out and about, then we will engage with them and then we will ask them questions. Those lawfully going about their business and sticking to the guidelines are absolutely fine. Those who are not, in the next few days, can expect that enforcement to occur, because we need to be robust in terms of that. It's so serious now that I think today some people still are not getting the message. OK, and if that's the case tomorrow, that's the case the day after, then unfortunately we will have to start adhering, we will have to start issuing fines to people. But all being well, over the next couple of days, people will get the message, people will stay at home unless they need to go out to get essential shopping, they need to go and get medicine, they need to travel to and from work. OK, so all being well, people will stick to that guidance. But, you know, we will be continually engaging with the public. So don't be surprised if you're out and about and you stopped and you ask where you're going and what you're doing.
OK, so I'd like to draw it to a conclusion there, but I think we've all could in unison say one thing, which is stay at home. So please, everybody, do just that. Thank you very much. And we will continue to try and keep the members of the public updated as we progress. So thank you for everybody for coming, and I hope your work for the remainder of the week goes well. Thank you.